Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, my name is Arief Iman, and I will present my research here on even ICOMMSET 2020. Okay, let me share my slide presentation. Here we are. First, this is my CV. This is my full name, Arief Iman, and I'm married with 3 children. This is my research. The title is The Effect of Clinical Documentation on the Accuracy of Diagnosis Codes in the Inpatient Medical Records. For introduction, medical records are official and legal documents that have legal value. Medical records have important aspects both for patients and for providers of health services where this patient gets services. The general principle of documentation on medical records are that medical records must be complete and can be read both in sheet documents or electronic. Medical information with high quality will produce better diagnosis, code quality. Study aims is to analyze the effect of clinical documentation on the accuracy of the diagnosis code in inpatient medical record at Dr. Soekarjo Hospital City of Tasikmalaya. And the method of this research is analytic quantitative. The sample in this study was inpatient medical record documents, as many as 289 files assigned randomly, and the tools or instrument of this research are observation sheets, an ICD-10 second edition device 2010 books comprising a volume of 1 until 3. Result and discussion. As you seen on table 1 about distribution of accuracy of diagnosis code, the most of the diagnosis codes in the medical records were not accurate, as many as 148 or 51.2%, and the remaining is accurate. Next to table 2, based on table 2, the most completeness of data and information in medical record is incomplete, as many as 187 or 64.7%. On table 3, the most of the writing in the medical records were not clearly legible, as many as 157 or 54.3%. On table 4, about specificity of diagnosis, most of the diagnoses in the medical records were specific, as many as 274 or 94 or 0.8%. And on table 5, C, the most of the use of medical terms in the diagnosis was appropriate, as many as 282 or 97.6%. Now we continue to the bivariate analysis. On table 6 shows that as many as 148 files or all or 100% of the files with incorrect diagnostic are all incomplete. And the result of statistical tests using chi-square show the value of p 0.000. This result indicates that the completeness of the data and information in the inpatient medical record has a significant effect on the accuracy of the diagnosis code. Based on table 7, show that as many as 148 files with incorrect diagnosis, as many as 3 or only 2% are not specific. Meanwhile, of the 129 medical records with the correct code, have 8.5% were not specific. This research statistical test using chi-square show a value of p 0.016. This indicates that the specificity of the diagnosis have significant effect on the accuracy of the diagnosis code. Next to the table 8, so that of the 148 files with an accurate diagnosis code, among 120 or 81.1% were not read clearly or not legible. The result of statistical tests using chi-square show the value of p is 0.000. This result indicates that the clarity of writing affects significantly on accuracy of the diagnosis code. Next to table 9, based on the table 9, so that of the 148 files with an incorrect diagnosis code, only 3 or 2% use term that inappropriate standards or guidelines. And the result of statistical tests using Visual Exact survey of P 0.717. This result indicates that the use of medical term does not significantly affect to the accuracy of the diagnosis code. We move to table 10 for multivariate analysis. We see that based on the above table, it's known that two variables that meet these requirements, that, which is the clarity of writing variable as the significant value, 0.000, with an OR value of 12.540. It can be concluded that the clarity of writing was dominant from all the independent variables that has affected accuracy of the access code. The R value obtained is 12.543, meaning that the doctor's not legible writing on inpatient medical record has chance of 12 times, causing an accuracy of the diagnosis code. Next is a discussion. The completeness of the form of medical record is very important to support the accuracy of the diagnosis, including the need of codification of the diagnosis. In order to obtain a code for correct diagnosis and procedure, it is important for a coder to first analyze the completeness of the forms in a medical record document. The clarity of writing the content of medical record has affecting accuracy of the diagnosis code. Writing the contents of the medical record must be written clearly and can be read by other health worker. Specific diagnosis in a patient medical record file had a significant effect on the accuracy of the diagnosis code. Writing a detailed diagnosis and specific will make it easier to determine the code in a more detail, especially for the coder. According with the result, that there is a relationship between the specificity of the main diagnosis and the accuracy of the disease code. And only one variable here after the result of a statistic test indicate this use of medical terminology of diagnosis in patient medical record did not significantly affect the accuracy of the diagnosis code. For the multivariate, completeness of data and information, specificity of diagnosis, and clarity of writing have a significant effect on the accuracy of the diagnosis code. The most dominant factor affecting the accuracy of the diagnosis code is the factor clarity of writing, with statement and clear writing of doctor on inpatient medical records has a 12 chance of using inaccuracy in the diagnosis code. And the conclusion are completeness of data information, specificity of diagnosis, and clarity of writing have a significant effect on the accuracy of the diagnostic code. And the most dominant factor affecting the accuracy of the diagnosis code is the factor clarity of writing, with statement and clear writing of doctor on inpatient medical record has 12 chance of causing inaccuracy in the diagnosis code. This is reference, and thank you for your attention. And I hope I've got a lot of suggests for all of you that you can write down on the comment below. Okay, thank you. And this is the end of my presentation. And I hope we will see you soon. Bye. Assalamualaikum warahmatullahi wabarakatuh.